Welcome to Saving America. This is your host, Dr. David D. Schein. Our series of interviews for Saving America establishes that the world is full of interesting people. Once you hear from our next guest, I'm sure that you will agree that he deserves the moniker of interesting person. We've got Peter Basica, who is the founder of 360 Smarter Care, a company dedicated to lowering healthcare costs. And boy, can't we all use that. His mission is to deliver the 360 solution to as many companies as possible so their employees can lead healthier and more productive lives. 360 Smarter Care uses behavioral RX to support each person's day-to-day lifestyle based on their unique emotional, behavioral, physical, and metabolic needs. This has produced evidence-based improvements in long-term care, transitions of care, and closing gaps for patients with chronic and complex conditions. And it's not an app, but a science-driven behavioral and cognitive method powered by the CARBS, C-A-R-B-S, all capital letters, machine learning technique. We welcome Peter Basica for his first appearance on Saving America.
Good morning.
Hey, Peter, it's great to get a chance to meet you. And I don't think there's a single American out there who isn't interested in lowering their healthcare costs and being healthier. And as someone who's recently had a bunch of tests, I can tell you the costs are extraordinary. So, how does 360 Smarter Care help employers lower costs?
We get people to actually follow doctor's orders. That's the biggest issue that we have. There's a WHO study out that shows people who are hypertensive, not only to get a blood pressure pill, but they're told, lose 5 or 10 pounds, exercise more, reduce your sodium intake. Taking their pills on time and doing those three simple things amount to 27% of the people who get that prescription and care plan. If you don't take your pills, if you don't lose a few pounds, if you don't exercise, if you don't trust your doctor and follow directions, it's amazing. You don't get well. And if you don't get well, the cycle just repeats and repeats and repeats. So, what we do with all of our behavioral science really is over a period of 36 months, get people to follow the doctor's orders. And if they simply take their pills on times and adhere to the care plan, they get healthier and care costs go down.
That sounds pretty straightforward. Now, in our in the material that you sent to me, it does say it's not an app. So, what is the mechanics behind it? How does it work?
Apps are a lot like gyms, in our opinion. The gym is full in January, February, and part of March. And by April, the gym is empty. We use text messaging. We send you as a user, not as a patient, but as a user, one or two text messages a week that are appropriate to your particular health situation, your life situation. We also build for you what we refer to as a dashboard or a user page. And on that user page, it's divided up into three sections. The first section, when you sign in every day or when you sign in, just asks you how you are. And if you say you're feeling great, we will give you some kind of silly reinforcement. Maybe it's Farrell singing happy, but just something to try and keep that smile on your face. If you are at the other end of the spectrum, we give you tools. You know, maybe you want to listen to this guided meditation or per, perhaps a musical intervention, or you're a reader, you want to read something about how to handle depression or anxiety or stress. But we get to know you and provide that. But we have a curriculum that we put people through on an annual basis and keep updating it so that the middle of the page is generally a healthy lifestyle. But if you're diabetic, it'll have a focus on diabetes. If you're hypertensive, if you have a cardiac condition, there's special information. And the bottom third of the page are your favorites. We are very much in favor of doing things like stretching. Doesn't have to be yoga, but body movement, things like that. We do musical interventions, guided meditations. We do yoga. We do breathing exercises. And when you find one that works for you, you put that in your favorite section. So we remind you to do certain things via text messages, and you remind yourself through your own homepage what works for you.
Sounds very interesting. Now, somehow you related this to systems to help with the shortage of medical providers in rural areas. How does that work? Because I have, separately have read that there's a really growing situation because we've got such great health care here in Houston, Texas. We have Texas Medical Center, incredible facility. But I think about people out there in the more rural parts of America who don't have any doctors at all in some cases.
People in rural Montana, as an example, travel over 100 miles to see a primary care doctor. Think about that, 100 miles just to go see your regular primary care physician. But what we're doing, we've actually been working with the University of Illinois and their Carle Illinois College of Medicine for 2 years on a program that we believe is really the solution to rural healthcare. Uh, if you go back to the 1930s, most of the interactions between a physician and a patient took place in the patient's home. The doctors made house calls. And what's interesting about that is that doctor took care of you. When you had a child, they took care of your child. When your child grew up, they took care of their children. They weren't just a doctor, they were a member of the family and they were trusted. And over the years, that trust has been eroded. When we ask people today in surveys, not us in particular, but when they're asked if they have a primary care physician, they say yes. When the survey drills down, it means they go to the same urgent care center. They don't have a
Oh, gee.
primary care doctor, they just go to the same place. So, our concept for rural healthcare uses technology to bring house calls back. There are three different devices that are available in the United States, FDA approved, that do remote medical grade diagnostics. And what we mean by that is literally you can start an appointment with your doctor, take the device, hold it in your ear, and the clinician on the other end will say, tilt it up, down, pull it out a little bit, go left, go right. And they can diagnose an ear infection just as though the physician was holding an otoscope in your ear in their office. These devices are so sophisticated, one can even do a 12-wire EKG as though you were in a high-end clinic. So with that technology and with our digital therapeutics, we can begin to rebuild that patient-physician relationship. And because these are so time efficient, a doctor can see more patients. That's how we can begin to leverage this. And in working with the University of Illinois, one of the things that we have under discussion is actually using third and fourth year medical students to take calls, because that third and fourth year medical student is well above the level of a physician's assistant. So we can expand the labor pool and begin to get these young doctors in training real world experience while they're being supervised, but real world practical medical experience. It's a holistic way of looking at care. And what we want to do even further is collect and create a database with real patient information, with payer information, and add to that environmental determinants and social and economic determinants, and leverage that database through the eyes of these young students. And why are we looking towards the young students? Because if you brought 20 doctors together, if you brought 100 doctors together today and asked them questions based on the way they've been practicing medicine for 20 years, they give you roughly the same answers. But if you ask an unbiased medical student to research something, the way they're going to query that database is entirely different. And it's fresh and it's new. And we expect tremendous breakthroughs to come from their fresh eyes.
That sounds like a great opportunity. And I had a follow-up question on that, but I'm going to ask it as part of the next question. U.S. hospitals are being warned to prepare for potential distributed denial of service attack. And I can directly relate to that because, as I mentioned, I'm a university professor when I'm not doing webcasting. And our university had a denial of service attack 1 week before school opened for the fall semester back in August. And as far as I know, we did not pay the ransom, but they had to entirely rebuild their website. And over the first 4 to 6 weeks of the semester, we had to rebuild. Fortunately, we were not dealing with health related information, but my goodness, as if that had been a hospital where you've got patients' lives at stake, a little bit different opportunity and things like that. So that the reason I was thinking of that with regard to your previous answer was because of the how do we secure the medical data that's then being made available through these systems? So kind of combine things there.
Well, I'm going to answer that in two different ways. First of all, it is an unfortunate reality that almost all of us have their medical information and personal information already on the dark web over the series of breaches that have occurred over the last 5 years. It's out there, and if we have the shred of an illusion that we still have privacy, we're probably kidding ourselves. Having said that, DDoS attacks are unique because it isn't a virus that got planted into your system. It's an attack from hundreds or thousands of routers and remote points where the virus has been planted in them outside the ecosystem of the facility or the university or the hospital. So, with the warnings that have been issued to medical facilities over the military action in Iran, they have prepared, and what they'll literally do is throttle down the amount of inquiries that can come into their system to keep them up. They'll just limit it. And we shouldn't be facing loss of data. What we'll be facing most likely is slow movement of data within the hospital. Uh, People going into the emergency room are going to get the treatment that they need. But somebody waiting on the results of an MRI, they might have to wait hours, maybe days, because the system has been bogged down. But overall, medical care shouldn't come to a screeching halt. It shouldn't be as bad as what happened to your university because they've been forewarned and they're larger and have more tools to protect themselves. But if you just think of the incoming flux that is supposed to paralyze the system, they're just going to turn the valve down and reduce the number of incoming inquiries. But that will slow down the systems within the hospital.
Well, it's a mega challenge. And by the way, I certainly agree with you regarding the dark web. Uh, it's a very scary situation out there, and it's incumbent on all of us to be as careful as we can. But as I mentioned, I recently had a series of medical tests from different clinics. Every single one of those clinics or imaging companies required all of my personal information. And I'm sitting there filling the forms in. I'm a pretty reasonable guy, and I'm sitting there thinking, this is an awful lot of data to protect. And I'm just wondering if there's some path forward that we haven't seen yet. Maybe your company will come up with it to see if there's a better way to take in data and secure it.
The better way for the medical professionals is they want one single system. Um,
Mhm.
so as you went for the different tests and had to repetitively enter that, they want it to be one system so that the information moves across the board seamlessly. And from the patient experience, you're not doing that repetitive filling out of forms. That's the good news. The bad news is it becomes one system, and now everything is in one place. That one gets hacked, everything is gone.
No question about it. Peter Basica, great visiting with you. How can our audience get more information about you and your healthcare related activities?
Our website is 360, the digits 360smartercare.com. We welcome you to visit there. And just one last thing I'd like to say before we go, due to the nature of your show. Uh, our prayers and our thoughts are with all those who are in harm's way. And if there are any veterans out there listening that need somebody to talk to, reach out through the website. I will personally call you back.
Well, I sure do appreciate that as the son of a 28-year veteran of the U.S. Navy. So, it is correct that on Saving America, we do strongly support the members of the U.S. military. And so we're glad to share that sentiment with you. I want to mention a special promotion that we're running on our YouTube at Dr. Dave Saves America. We have passed 1,000 subscribers, and we're now on the road to 3,000 subscribers. And if you're interested, in the comments, tell us if you want Bad Deal for America or you want Decline of America. We will be having a drawing after we pass the number 3,000, and people who have posted that they want to be in the drawing and indicate which book they're interested in, and we'll be sending them that particular book. And we appreciate your listening, and we appreciate your participating at our YouTube channel at Dr. Dave Saves America.